Hello everybody, I'm at the EHA meeting and I'm happy to talk a little bit with the AML Global team about recent advances in allogeneic stem cell transplantation, including some observations I personally made here at the Congress. I think at the moment we are still facing two major issues in stem cell transplantation. The first is that still a considerable cohort of patients do relapse after stem cell transplantation, and on the other side, graft-versus-host disease is still a major challenge we are facing in the clinical care of these patients after transplant. So what recent advances have been observed or have been made in the field? I think our understanding on the individual risk of patients relapsing after transplant has much improved with the techniques of so-called next-generation sequencing, where we can obtain better information which patient has a high risk of relapse after transplantation. Those are the patients who actually are MRD positive prior to transplantation. So we are about to develop some individual risk scores for patients predicting the risk of relapse after transplantation based on MRD level. So MRD level is a very important information for these patients, and strategies aiming at preventing relapse are underway. And these include maintenance treatment, so just to give a flat maintenance treatment with anti-leukemic drugs after transplantation in order to prevent the risk of relapse, or so-called preemptive strategies where we measure MRD level after transplantation and treat patients only at a certain level of MRD. So, which basically would indicate that this patient relapses within the next 8 to 12 weeks after the detection of MRD. So I think the implementation of MRD in the management of patients pre and post-transplant, I think, is a major current effort of clinical research, also translational research, and will hopefully improve the outcome of these patients. Second major bullet I would like to make is graft-versus-host disease, still a major threat for our patients after stem cell transplantation, irrespective of a lot of efforts, including graft-versus-host disease prophylaxis with ATG, cyclosporin, and so on. And many of these patients develop severe forms of graft-versus-host disease which are life-threatening. So I think we have now JAK inhibitors within clinical trials, and they seem to be, for instance, ruxolitinib seems to be a very promising agent and has been recently already obtained FDA approval in the setting of severe steroid refractory graft-versus-host disease. So I think also along those lines, other compounds are tested, not only in the treatment, but also in the prophylaxis setting for graft-versus-host disease.